uh, Veyu Christine. I am a counselor of one of the government school in the place. So I'm also dealing with traumatizing people. So and our responsibility is to really guide students and orientate students and sensitizing them concerning all the different issues that I have. We can say that issue of drugs is very serious in amongst youth. We can say that is true because the phenomenon is really taking over in amongst youth.
Statistically, what percentage of your students can you say are into drugs?
Concerning our students, we can say that statistically it can go from 10 to 15% in our school. So that's where we can around the issue statistically.
Okay. In your opinion, what can you say is the cause of students getting into drugs?
Concerning my own opinion, I can say that there are many sources of that is pushing students to really be into drugs. First of all, we can talk about lack of follow-up of an education of parents, because when parents are absent, then the student can be free to do what they want to do. And then the second thing we can talk about imitation, because there are many that are going there because they just want to see what their friends are doing. And thirdly, we talk about the environment. If you are in an environment where people, or you are seeing people taking drugs, you will likely also want to follow the issue. There's another thing, another cause that can be a failure, can be source of that can push students to also take drugs. We have depression. We have the issue where the students are traumatized, maybe by the divorce of parents, or some that have gone through rape situation. So, and we have this one that is now very common, that is social media. So through television, phones, and all those things that social medias are sending out. Thank you.
What are some of the drugs taken by your students?
We have different type of drugs. We have there are some drugs that that have the results of that they call depressant. Those are type of drugs uh, that have the function of touching the central nervous system. And those kind of drugs, we have alcohol, for example, that is also drugs. We have a tranquilizer, yes, that is one of the that is entering in one of the group. We have the another type that is stimulant drugs. Those one we have cocaine, that that can exist. Also we have also this caffeine that student can take. But we have that opioid drugs that is very common amongst youth, such like tramadol, tramadol, traba, and those are really such of drugs that students are really taking.
How is drug intake affecting students, their studies, and school in general?
Okay, generally we can say that drugs is very harmful in physical way, personal one, and is also affecting the student himself and the society. Now, if we talk about drugs affecting the body, we have students that are sleepless, because when you are taking drugs and most of the time you find yourself being a sleepless person. We have convulsion, we have hallucination, and we have also things like mental disorder, behavioral disorder, memory lost, because sometimes you can ask them things and they find themselves very lost. We have also things like addiction and school failure and even dropping. So those are type of things that really affect the body. But we also have the such that are affecting now our organs like heart, brain, digestive system. Those those can also give a way to diseases like cancers. Um, when we talk about in the large side, we can talk about society, because when we have students that are taking drugs, is really taking is really affecting them in such a way that they are very aggressive, always fighting amongst them, violence, and it can even lead to killings. So we have such things and madness, and some can even commit suicide. It can go to the extent of committing suicide.
With this critical problem ruining the lives of students, what is your school or Ministry of Secondary Education doing to help these students who are unfortunately already taking these harmful substances?
Okay, we can say that the Ministry of Secondary Education, we have what they call medical doctors for schools, because normally in French they say le médecin scolaire. So when we have such students that are really taking those kind of things, we always refer them to those doctors that can really get in contact with the parents and lead the parents how to solve the problem or how to help their students. Now, in the school milieu, we have counselors. So there are counselors that are in the school milieu and working with teachers and the administration. So when we have that kind of we have students that are taking drugs, we always sensitize them, especially for some data in the beginning. We always take charge of those students, and then we follow up to see whether they can stop. And inside our concerning the origin, because the student can only take what is available. So if the state can really sensitize not only parents, even the nation concerning that availability of drugs, will be really good, because we cannot just blame the student, but where are they taking it from? So it means those drugs are really available. So, and that's one of the issue that we can really plead, especially for the measure that the state can take, so that those drugs should not really be available for students, because that one can limit the can stop the student to really take it. And another issue is a great sensitized movement of parents to really uh, follow up students, because when they have problems, it really affects students, and then they are now looking for solution outside. So those kind of thing will be really good, sensitizing parents a lot, and then making sure that those drugs should not really be available, just in case that the person really need it. And we know that many of those drugs are used for some disease, so that one is another case. But when it is available for students and all those and all type of people, so they will likely take it. So we really plead for that that measure of controlling the 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 the, that drugs in that circulating way of drugs in the nation. It will be very good for us, and then help the students to reduce, at least while we are sensitizing them in school, and then also sensitizing parents to really follow up